Hey guys, this is Dr. Jeff Ellery, Whole Body Health, with Bryce, my son, and he's having some shoulder issues. So what we're going to do today is show you how I would treat someone's shoulder using Gua Sha. It's just something you can do at home. You can have your friend, spouse, kids, you can have your family work on this, and it's something that you can do with minimal risk of injuring or worsening a problem, and oftentimes get pretty significant relief. So we're going to work on Bryce's shoulder. He said it's been bothering him here in the front of the shoulder, but I'm always going to treat both the front and the back. So today we'll start with the back. It does help if you know a little bit of the anatomy of the shoulder, because there's you want to stay away from the collarbone, scraping over the collarbone, the skin of the collarbone, and there's what they call the spine of the scapula right here. You want to be careful not to scrape over that, because you can really tear up the skin of there. And so there's a pretty sizable muscle here. You got the upper traps and supraspinatus in here, and then we'll kind of work the whole deltoid. We'll turn around and work on the front as well. So I'm always going to use lubricant. I'm never going to do scraping straight over raw skin, because it'll have a tendency to get irritated, or you can actually break the skin pretty significantly as well. And so first thing I'm going to do is just move that oil, just kind of lubricate the area, and then the way I determine which direction I'm going to scrape is I'm going to move towards the shoulder. So I'm always going to move in one direction first. I tend to try to follow the direction of the muscle. I don't want to go crossways to that muscle, so I tend to follow the direction of the muscle. When I do this, I'm getting a little bit of crunchy or gristle feeling. It feels like sandpaper right in here. Then I'm gonna go the opposite way, and I don't feel as much in this direction. You agree with that?
Yeah.
Okay. So I'm just gonna come right in here. I'm not pushing real hard, and I'm supporting his shoulder on the front, because it's gonna move a little bit. A lot of times I'll have somebody lay down and do this, but it's perfectly fine to do this in a sitting position. And I will continue to work that muscle until that sensation of grit or sand subsides, either completely or significantly. There's a little bit right here too. Oftentimes you can tell whether you found it is if they get defensive and start moving away from you. Another reason to hold them still. But I'm not pushing hard enough. I'm not digging in here and pushing so hard like I'm trying to hurt him. All I'm doing is trying to separate those layers just by putting a firm, steady pressure. And then I'm gonna come up here to the upper trap and do the same thing. So I'm gonna move towards the shoulder, and I'm gonna move away from the shoulder. It's got a little bit right in here, so I'm gonna work that. So I'm doing kind of getting the combination of the upper traps and the supraspinatus muscle. And I'm a little bit lighter because there's bones right in here, so I'm kind of just going really light and careful to stop at that bone. Bryce is making a face like it is sensitive, which is not surprising. So you can kind of see where, as I'm hitting this area right here, this little triangle, that's kind of the insertion of some muscles, and it's actually, this is not breaking the skin. This is what they call petechiae, where it's kind of some rupture of some capillaries, and it's actually good, because it'll create new capillary growth in that area as well. So there'll be some healing going on there. And then I'm gonna do the same thing with the shoulder. I'm gonna move up first on the shoulder, and then I'm gonna move down. And so let's go ahead. I feel a little bit of restriction right there, or adhesion right there, sand, crunch, gristle, whatever you want to call it. So we move Bryce to his back. We want to work on the front of the shoulder, the deltoid muscle here, which again runs from the collarbone to the upper arm, and then we're going to work on the divisions of the pec muscle, or the chest muscle. And so I'm going to go ahead and kind of finish this area. I put a little bit more lubricant on here, and I'm just going to work this. You can actually, that's probably the most crunch I've felt since I've started working on Patrick Swayze here. And so we're gonna work on that a little bit. I'm not in the best form. Typically I would recommend people use better form, but just so you could see it, I wanted to make sure that I was out of the way. And then starting to release there. What I like to do for the pec is I like to stretch that muscle. So I'm gonna have him put his hand right there, actually right there. And he's really loving this. Yeah. And I don't, well, that's actually more. Yeah. So crunch going this way. So I felt crunch going this way. I thought, oh, we found it. But then I come back the other way and it's even crunchier. A couple things I want to note. Whether you're working on a male or female, don't scrape over the nipple. We want to keep that attached. It's really important. If you're doing this work on a female, you want to make sure that they cover and pull the breast tissue down, because you do not want to necessarily, you don't want to go in there and work deep tissue on the breast tissue. And so you want to get underneath it so you can move it out of the way and you can work that tissue. So you want to relax that arm a little bit. So let's do this. Put that hand under your head. There we go. And so we're just going to work this. So we released the pec in the front, the shoulder, and the back. That's typically what I'm going for when I'm working on somebody's shoulder. The other thing we're going to do is we're going to come back and we're going to do some cupping as well, just to kind of free that shoulder up a little bit more. Again, you want to stay, I don't want to scrape around the bony tissue. If I did, I would be very, very careful to go along the edge of it. The same thing would be true for like shin splints or something like that. You need to be super, super careful, because it can really, really, it's just such a thin layer of tissue between the bone and the surface, so you want to just be careful. So thanks for joining us. Be sure to check our links below for where you can get a Gua Sha, the videos on what Gua Sha is and how to perform the Gua Sha, as well as our different cupping videos. Thanks for joining us.